Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders, presented by CNS Healthcare. I am your host, Nancy Gandolo, Chief Marketing and Outreach Officer. We want everyone to know your mental health matters and it is okay to not be okay. Before we begin today, I'd like to announce our winner from last week's survey, Katie. Congratulations, Katie, and thank you for watching. We will be emailing you your gift card. Joining us today is Jenny Shumaker, Senior Program Director at CNS Healthcare, who will be talking about caring for those who care for others. Jenny, welcome. Please tell us a little bit about yourself and then let's dive right in.
Hi, everyone. Jenny Shoemaker, Senior Director of Program Operations here with CNS Healthcare. I have been with CNS 8 years now. I've had a multitude of roles within just community service and nonprofits and mental health. I started off working with the homeless population, which really led me to working with those living with mental illness. So I'm excited to be here, and we can really talk about what it means to care for our caregivers. I think it's really important. I just want to start off by saying it's really important to not really brush off the challenges that mental health professionals are going through right now. At the core of this, we have to remember that our mental health professionals are spouses, they're parents, they are breadwinners in some of their families. They are friends, and the emotional distress that they've experienced over, the last 2+ years through this pandemic has really been unimaginable. So it's important that we keep the focus on that and how we can help the people that help the most vulnerable really stay healthy.
Jenny, can you give us some of the things you believe are leading to this burnout? And, I would preface that by saying it's happening with mental health caregivers, but it's also happening with all types of caregivers.
Absolutely. So many studies have been done, over the last 2+ years of kind of what is leading to this. And, in some of the studies, it showed that, 78% of psychiatrists are self-reporting burnout. 90% of burnout was found in a study of college, counseling practitioners. And so it's happening everywhere. And so it's not just specific to mental health, but anything that really involves crisis or first responders, you're at risk for experiencing this compassion fatigue and this burnout. I think there's a few themes that are happening right now across the nation. And we see it even here, at CNS with our mental health professionals. It's there's a mental health crisis in America, and it happened. It started pre-pandemic. Budgets continually get cut. The public mental health system specifically is an underfunded system, and so fast forward, through a pandemic, and the number of individuals accessing services really had a huge impact on our mental health professionals. The second thing, I would say is the shortage of mental health providers. The U.S. Department of Health and Human Services back in 2016 predicted that we were going to have 250,000 plus, a need for that many more mental health professionals. That was before we even knew that there was going to be this thing called a pandemic. And so that significantly increased as the need for mental health services increased. And then it kind of aligns with that is the diminishing professional boundaries that are happening in mental health care right now. And when I say professional boundaries, I don't mean anything, unethical. I mean, people are at an all-time need for services, and so people are extending their work days, going above and beyond what they typically would, as a mental health provider. Not being able to say no. I mean, that's a huge thing, and it's definitely leading to burnout.
Do you also think that part of it is because, we're loosening the stigma around mental health, right, and encouraging people to get help, and so we're seeing more people seek out help than we have previously because finally, and rightly so, the stigma is we're making progress. That's not to say the stigma doesn't exist, but we're definitely getting closer to it being acceptable for people to talk openly about the fact that they're seeking mental health help or they're talking to a counselor and things like that.
Absolutely. I could not agree with that more. I think it's more out there. The awareness is there. It's more widely accepted. And I think in those very early days of the pandemic, when everybody was locked down, everybody could slow down for a minute. People could slow down. A lot of things that were happening surfaced, and they said, wow, maybe I should seek help for this. I finally have an opportunity to do this that I haven't had before. So let me reach out and see where I can get help from. And I think it's definitely led, which is a good thing. We want people to reach out for help, but we also need the workforce behind that to be able to serve these people.
100%. So what do you see the burnout looking like in all of the professionals, be it psychologists, psychiatrists, first responders, police, fire, nurses, teachers? I'd argue teachers, because I think teachers are facing burnout as well with all the things being put on their plate.
Absolutely. It's a combination of things, and it looks different for everybody. And so it's important to remember that what's going to look, the same for one person and how they deal with stress and their coping mechanisms is going to be completely different than somebody else. So there's growing empathy fatigue, emotional exhaustion. Some symptoms of this could be, changes in mood, lack of motivation, anger, anxiety, hopelessness. When you feel that you're not making a difference in the work that you were doing, it can cause a lot of that hopelessness and you're just not having the impact that you would like to see. Difficulty thinking, lack of concentration, sleeping problems, and then the physical changes that people typically see when any kind of stress enters their lives, the loss of appetite, the headaches. A big one is the reduced feeling of personal accomplishment. People really, it's just human nature that, you want to feel accomplished in the work that you're doing. You want it to be meaningful. You want to have that meaningful impact either in other people's lives or the community. And when you're not seeing that, it can really cause some of these symptoms. I think it's important too, when we think about our young professionals, we really talk a lot, in schools of counseling, schools of social work, any of these programs that people are in that are going into the mental health field, we really start on day one talking about vicarious trauma and what that is and secondary trauma and taking on somebody else's story really and taking on their stress. And, there's a quote from Kitchen Table Wisdom, and the expectation that we can be immersed in suffering and loss daily and not be touched by it is an unrealistic as expecting to be able to walk through water without getting wet. And I think when we talk about all of these symptoms that people are experiencing, we have to be realistic that it's going to happen, but we also have to acknowledge that it's happening and what can we do for the people that are serving the most vulnerable. I think for years we've talked about it. We've talked about, okay, this happens, this is what it looks like, please be aware of what's happening. But on the other end, I don't know that as much effort has been put into how can we help support you once you do start experiencing this. I would say that is one silver lining over the last 2.5 years is that we've really crossed that bridge, that we're not just talking about it anymore. We're trying to help support our staff and the people in the community and all of these first responders that are doing this work.
Great. If you're just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. We are speaking with Jenny Shumaker about caring for the caregivers. Jenny, you have spent the last few minutes talking about the symptoms of burnout and what that might look like and some of the signs of that. Can you go into what we can do about it? Just the average person, what we can be looking for and how we can help them?
Absolutely. It's important to take care of your mental health just as you are taking care of other people's. Mental health is health, and we want to make sure that we're doing things and we're adding things to our life that's going to keep us healthy. Really knowing and respecting your boundaries as a professional. If you've set your work day, if you're a therapist and you've set your work day, from 8:30 to 5 or 9 to 6 or whatever it is that your schedule is, it's being okay with saying, no, I'm not taking, any more clients after 6 p.m. because I too am a person. I have a family. I have responsibilities, and I have to pour a little bit into myself so I can continue giving to others. And so being, really knowing and respecting those boundaries around your work, which we all know it's easier said than done, but consistency is really important. And just taking that first step, just trying it. Saying no is hard, but it's really important to keep yourself healthy. Self-care activities. I know we talk about self-care a lot, right? And you can go to Google, do a Google search, or go to a blog about compassion fatigue. It's going to have all of these things about self-care, and self-care really does look different for everyone. And what I will say is find something that is enjoyable, even if it takes 5-10 minutes a day. It doesn't have to be a full day of PTO to go get a massage and do all of these, typical self-care things. It has to be something for you, whether it's reading a book, reading a magazine, taking a walk, talking on the phone to a friend, whatever that looks like for you, I really encourage. A big one is restorative activities, yoga, mindfulness, meditation, deep breathing exercises, getting enough or additional sleep. These are the ones you typically hear about a lot, but, the reason I really recommend these is because, part of that, those feelings of feeling like I don't have any time and I'm overwhelmed and I'm rushed, it really, those are really tied, to your nervous system, the sympathetic nervous system. And so when you do these restorative activities, it kind of helps manage that. It kind of pumps the brakes a little bit on that fight or flight. And if you do it consistently, it's going to sound a little hokey, but it really does change the way you think about time. So when you say, well, I don't have time to do that, and I can't do that, and I'm rushed, and it really helps you slow down, think a little more clearly, and realize, the things that are important to me, I really need to fit into my schedule, and I need to make sure I do them so I can be healthy. There has been so much research and studies that, that have been done on the impacts of meditation and mindfulness and yoga. And I really encourage people, to do it consistently, because that makes the difference. It's just like, anything else we think about health, like diet and exercise. If we want to lead a healthy life, we can't exercise once. It has to be consistent. And it's the same way with our mental health. Just anything, go for a walk. It's summertime right now. And so go for a walk. The weather is breaking. It's getting so much nicer. Take that time for yourself, even if it's 5, 10, 15 minutes a day. It really will make a big difference.
And it's really the theory of putting on your own oxygen mask before you put the oxygen masks on others. And I guess I'd love to ask you before we wrap up today, what's the one key takeaway that you would tell everybody listening today?
It really stems from, you cannot pour from an empty cup. And so I encourage all of, everyone listening today, and, all of your colleagues and friends, if you are in a service field, in a helping profession, a first responder role, to really step back and ask yourself, is my cup full today? And if you say, I'm not sure, or no, take a step back and think, what can I pour into my cup so I'm not pouring from an empty cup? Because we cannot do for others if we are burned out and if our cups are not full. And so that's, if I can leave you with anything, it's to fill your cup, find out what it is that's going to make that cup full, so we can continue to do the important work. Because at the end of the day, you are valuable beyond measure. The agencies you work for need you. The people in the communities that you're serving need you. You're appreciated, and ultimately the world needs you. We cannot do this work alone.
Thank you again, Jenny. We loved speaking with you today and appreciate all of your sage advice.
Thank you. It's been wonderful.
For the rest of you, thank you for joining us today for Bright Spot, CNS Healthcare's new virtual show. We hope you will mark your calendars and continue to join us Mondays at noon to discuss feelings, struggles, and finding one's way. If you have a topic you want to hear discussed, please drop it in the chat or comment on this video. To remind you, we will select one winner for a $25 Amazon gift card and announce it next week on Bright Spot. So please take the time to fill out our 2-question survey that is linked in the chat now. Before I sign off, I just want to remind everyone to be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Have a great week.